Hello, and welcome to Why Do We Do That? A psychology podcast that deconstructs human behavior from the perspectives of social scientists, psychologists, and others that use applied psychology in their work. I'm your host, Dr. Ryan Moyer. In this episode, I sat down with Dr. Patricia Resick, a renowned expert in the field of trauma and recovery. Patricia is Professor Emeritus in the Department of Psychiatry and Behavioral Sciences at Duke University, and formerly served as Director of the Women's Health Sciences Division of the National Center for PTSD at the VA Boston Healthcare System. With over 250 journal articles and book chapters to her name and 9 books published, Patricia has made significant contributions to the understanding and treatment of post-traumatic stress. She also served on the editorial boards of 9 scientific journals, including as associate editor for the Journal of Consulting and Clinical Psychology. Most notably, Dr. Resick is the developer of cognitive processing therapy, or CPT, a highly effective, evidence-based treatment for PTSD. In our conversation, we explore how CPT works and how it's detailed in her recent book, Getting Unstuck from PTSD, using cognitive processing therapy to guide your recovery. One big takeaway from my conversation with Patricia was the difference between hardship, trauma, and PTSD. It's easy to blur those lines, especially with how often the word trauma shows up online these days. But making those distinctions really matters, especially when it comes to understanding what kind of support or treatment someone might need. Trauma can fundamentally alter the way your brain perceives and interprets the world. The good news is that the idea that trauma is typically permanent is a myth. Many individuals will naturally improve over time, but even in the face of serious, long-lasting effects, there are real, effective ways to heal. Another key point was about how we deal with the emotional fallout of trauma. Avoiding those tough emotions might seem like the easiest path, but it usually makes things worse in the long run. Still, healing isn't as simple as sharing your story with anyone who will listen. There's an important distinction between reliving a traumatic event and processing it in a way that fosters growth. True recovery often involves making sense of the experience, especially by identifying and challenging the beliefs we may have formed in an effort to understand something that once felt unbearable. If you've experienced negative events in your life that have had a consistent and prolonged impact on your behavior or your ability to live a happy, flourishing life, I hope this episode will give you some hope that healing is possible. Enjoy. All right, today I am joined by Patricia Resick. Thank you so much for being on today.
Thank you for having me.
We're going to be talking about trauma today, both trauma and the pathology that can relate to traumatic events. Why don't we start by giving a definition of trauma? And I think based on where I see this conversation going, how trauma might be different from post-traumatic stress disorder, also known as PTSD.
Well, and you can even take it back a step, the difference between trauma and bad events that aren't trauma. Because I think the word trauma gets overused and misunderstood. And so people say, oh, that was very traumatic, when in fact, that may be in their minds, but it wouldn't be diagnosable.
Right.
A trauma is a very serious event. It's usually a sudden and unexpected event that is life-threatening or life-threatening to a loved one. It can be sexual assault would be included under that, even though that isn't necessarily life-threatening, domestic violence, but very serious events, not things like getting a divorce, the natural death of a loved one. Differentiating a trauma from a natural event would be the natural death of a loved one, like say by a heart attack, versus someone who's murdered. That would be a trauma.
And the piece of having it unexpected, is that a big piece of the trauma? I mean, can you have trauma that is gradual over time, or does it have to be a specific type of event?
Usually it's a very specific moment in time when you suddenly realize you've lost control over an event and you could die. You have a large fight flight reaction. You're going to have other emotions that happen.
Yeah, so I've heard a version of the definition of trauma that basically says trauma is an event that fundamentally changes how your brain interprets the world. And again, that's a little vague, but do you agree with that kind of version of defining trauma?
Generally speaking, yes, I think it pulls the rug out from under you if you have a sense that the world is fair, and then suddenly something horrendous happens to you. And then suddenly you're saying, why me? Or what did I do? Or wondering why on earth that happened to you when you're a good person and bad things shouldn't happen to good people.
So you said that an or like a death of a loved one that is not unexpected is that probably would not be classified as trauma. Could you talk a little bit more about that in the sense of, someone listening might say, well, when this person, even though it was expected that my grandfather passed, it still affected me for a long time after. And it sounds to me like there's an important distinction between having long-term effects and classifying something as a trauma.
Well, using the term trauma leads us to thinking about whether somebody has PTSD or not, post-traumatic stress disorder or not. When people have a bad event, loss of a job, divorce, loss of a loved one, whether it's expected or not expected, those are life events that we can make sense of. And they, you have a place to put them in your brain. And of course, you're going to have reactions, but it won't be PTSD. It might be depression or anxiety or something else. And then how you handle it depends on whether you actually develop other kinds of symptoms or not. With trauma, you either develop PTSD or you don't, but that's kind of the gateway into to even look considering whether someone has PTSD.
I see. So, talk a little bit about what what do you have to see in an individual for them to be diagnosed with post-traumatic stress disorder?
Well, the symptoms look different. When you lose someone naturally or you have some other bad event happen in your life, you may think about it a lot. You may ruminate on it and so forth. The reaction is almost the opposite with a traumatic event where you're trying not to think about it and it keeps intruding on you. So you have images that intrude on you, um, traumatic memories of the event, like when you're starting to fall asleep at night, all of a sudden, bang, you're back in the event again and you're trying not to think about it. Flashbacks, nightmares, all sorts of things that can be uh, very emotionally provocative, meaning very strong negative emotions happen with those flashbacks, nightmares. You have certain thoughts that go with it, your interpretations of the event, physiological reactions, and so forth.
Mhm.
So there are, criteria that you would look for to start thinking about PTSD.
So how well do we understand what traumatic events do to the body? It reminds me, I lecture on stress quite a bit, and I talk to my students about how stress can be a good thing. It is the activation of your nervous system so that you can act and be effective, and whether that's moving your attention somewhere or physically moving, that fight or flight response is important. It's good for us. Um, of course, there's that fight, flight, and then the other categories, which is like freeze, which I don't really discuss in my course, but it seems to relate to trauma. Do we have a clear picture of how trauma impacts our nervous system?
I think we have a fairly decent understanding. I think for a long time, people focused too much on the fear and anxiety component of it because it was listed, PTSD was listed with the anxiety disorders. So it gave people tunnel vision for a bit. So we don't know as much about some of the other emotional reactions. But we're learning more, especially as they're doing more imaging of people. They're finding out a lot of people who don't have um, the sense of imminent death, but they had a trauma. In other words, they learn about the death of a loved one, or they're in the military as a medic, and they weren't threatened themselves, but they're having to deal with all these people who are badly injured, or working in a, like having to clean up after in a war zone situation. Any of those kinds of things aren't personally threatening, but you're going to have a lot of reactions to them. And often you have guilt or shame, or, I mean, you mentioned the freeze response. People often freeze with that sudden unexpected part that I mentioned. Like you have that second or two of like orienting, like what's going on here? Like something's happening that's huge and you don't know whether to fight, flee, do whatever. And so that freeze response is just a natural orienting response. But then afterwards, if people have PTSD, they may feel guilty about it. I froze and I didn't save my buddy. There was a school shooting and I didn't grab my friend and he ran down the hall and got shot. Um, so that freeze could even be one of the symptoms that they feel guilty about having had, which is, of course, a natural physiological response.
Why do you think that individuals have such irrational thoughts after traumatic events? I mean, it seems to me that they're trying to make sense of something that is
Yes.
new to their nervous system. Like if you picture the brain as a prediction machine, we want to, as you said, divorce. It's sad, but you can process it. But it sounds like trauma, you can't process it. Your brain is trying to predict, and it can't. But it still kind of boggles my mind why so many irrational thoughts get glommed on to these events.
Well, I mean, if you start instead of a biological model, if you start from a cognitive model, from the time you're born, you're always taking in information and categorizing it because we like to predict and control. We like the illusion that we can predict and control much more than we can. And we're also all taught the just world belief, which is that good things happen to good people and bad things happen to bad people. Our parents do not teach us, like, if you behave, things might or might not work out. They don't tell you if you misbehave or you run into the street, something may happen, may not happen. Now, as you get older, you learn that doesn't always work. Sometimes bad things happen to good people and good things happen to bad people. But when you're little, you're all taught that just world belief. And our parents teach it, teachers, religions, wherever you are, they're, simple categories for small children. So we have that in our heads, even though we may come to not to recognize that it doesn't work. But if a bad thing happens to us, we go and revert to that. Why me? Why not you? Um, so they start with that idea that you've got to have the things should be just and fair, and that you didn't. And so you look to yourself first, like, what did I do wrong? And so if you want to keep and hang on to that just world belief, that things are fair and just and predictable and controllable, then of course you look to yourself to say, what did I do wrong? How can I fix it? How can I make it come out differently? And you get stuck on that idea because you start avoiding feeling those strong feelings, having the flashbacks, the nightmares. You don't process the event. You don't think about the event. So you don't change your thinking about it. So you're kind of stuck with that if only I had done this, it wouldn't have happened. Or if I had been smarter, or if I had done this or that, it wouldn't have happened.
It seems as though that it seems like an extreme form of internalizing where, you're taking uh, you know, something that could be completely and utterly random, and then you're adding this unnecessary element of fault or blame, or internalizing. I had control, and I did, and I was in control of this moment, and I failed. Um, do do some people do all people react that way to trauma, or I'm trying to think about somebody who, on the other hand, is they externalize everything. Somebody who's nothing is my fault, and the reason of my lot in life is because of X, Y, and Z. It has nothing to do with personal responsibility. Uh, does does trauma have a different impact for somebody who might have a different type of thinking about the world?
Um, I think for an externalizer, they could externalize blame and then still have symptoms of PTSD though, but they would be acting out. They'd be more aggressive. They'd have the fight response instead of the flight response. Um, and so they would be fine-tuned to blame other people and be aggressive, but they're still trying to protect themselves and still trying to have that sense of control over the world. Whereas if you I mean, you could start out with a negative set of beliefs. If your parents were emotionally abusive of you your entire life, they always said you're stupid, you're worthless, and you make me hit you, or whatever it happens to be. You could start out with negative beliefs. And then a trauma happens, it's going to kind of fit into those beliefs. So you don't have to change as much. But it still doesn't quite work because you're still probably saying, but why again? Or why now? Or I thought that was behind me. So there's still a conflict there that you have to resolve. And so that it keeps coming back at them. The brain keeps actively making you try to think about it, and you keep trying to actively push it away.
Mhm. What are some common sources of trauma that the average person might not think of? So, the big ones that come to mind, as you mentioned, like a sexual abuse scenario, maybe a traumatic war event. But, as I've been doing some prep, I started to realize that trauma can be spread out over a longer period of time. It doesn't necessarily need a major life event. Are there some examples in your experience of traumatic events that just people don't really realize that what they're observing is trauma?
They might not label it that way, but if they're having those kinds of symptoms, they probably did have a trauma. And I things can drag out over a long period of time, like let's say domestic violence. But usually there's some event that's triggering those kinds of symptoms. Because you're going to have flashbacks about something if you have PTSD. I mean, you can have trauma. Most people, let me back up and say, though, that most people do not end up with a diagnosis of PTSD. That's another myth, is that if you have a trauma happen, you will get PTSD. If the event is severe enough, you're going to have symptoms for some period of time, but the large majority of people recover over a few months. Um, so only some people get stuck. So when we look at the big epidemiology studies, they'll talk about 10, maybe 20% of people having PTSD, whereas 90% of people will have a trauma happen to them in their lives.
Can we talk more about this? Because I think this is one of the more interesting points of I see that one of the more popular myths is that trauma is is permanent. You said that a 10 to 15% or whatever might move into a PTSD diagnosis. What are some other pieces of evidence that we know that show that the majority of people have the ability to process trauma and have that resiliency built in?
Well, there have been studies that have studied people over time. I mean, some of the early studies when we were first studying trauma would look at people like weekly after an event and watch their symptoms decrease over time. Like even with rape victims, 94% met all the symptom criteria. They didn't meet the time criteria because you had to have them for a month.
Hmm.
But it's absolutely normal. I mean, that was meeting the criteria for PTSD at the time, and that meant you had to avoid in at least 3 ways. So if you avoided in 2 ways, you were in that 6% probably. So it's almost universal to have some symptoms after a trauma. But the people who are going to recover are going to be feeling their emotions. They're going to be talking to other people about it. They're going to be uh, it's more of an approach rather than an avoidance stance. The problem is after a month or so, you're going to start saying to yourself, why am I not better? Or maybe even early on, somebody blames you for what happened. Somebody says, why were you there anyway? Um,
Hmm.
and 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 then you start saying, I must have done something wrong and I shouldn't talk about it with anybody. So then you start doing whatever you can to avoid. And and the key, I think the key to who develops diagnosable and long-term PTSD are those people who are avoiding. And by avoiding, our DSM says there's two kinds, internal and external. Um, a high functioning person with PTSD might be the busiest person on earth. They don't want to ever think about it. So they have 2 jobs, go back to school, coach every sport, and then they retire and then they get PTSD symptoms popping out
Wow.
because they filled every moment. A low functioning person with PTSD would maybe be drinking every time it comes to mind. And then they develop a secondary diagnosis of alcoholism or drug abuse or an eating disorder. Um,
Do
so
these types of behaviors, these like maladaptive coping mechanisms, does it make it hard to diagnose as well? I mean, I would imagine like if you had, we're going to talk about treatment in detail a little bit, but it strikes me that if these are really common things, people drinking after traumatic events, just trying to mask it.
well, other
I
people saying, here, have a drink. Yeah. Uh,
Right, yeah, and I feel like uh, it can kind of distort the diagnostic process, distort numbers. I mean, how do you, uh, if it, I feel like somebody might develop, they might just think that their primary problem is alcohol, right? It's alcohol dependency, and it's like, oh no, 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 it's not really the drinking. The core is the traumatic event. Is that how it tends to operate in the population?
Sometimes that happens if somebody's very good at avoidance. You might not even detect the symptoms of PTSD. I mean, I think every good therapist should get a trauma timeline on every patient, regardless of the diagnosis. So, what bad events have been, let's put a line here from 0 to, let's say you're 34 now. Um, what bad events have happened in your life? How old were you? If it's an ongoing event like child abuse, when did it start? When did it stop? Or child sexual abuse or car accident or, something else happening. And then you figure out as a therapist, did any of these things meet the criteria for PTSD? But they may not have those symptoms because they are in an alcohol program and they're being treated for their alcoholism or an eating disorders program or some other kind of uh, program for something else and are being treated for depression and you don't know. But having that timeline, if you take the alcohol away, the flashbacks are going to start coming back and the nightmares. And that's when you can start saying, okay, I think you got PTSD here. You can't diagnose it if they're not having the symptoms, if they manage to squelch them enough by all the different kinds of avoidance they do.
Could you talk a little bit more about flashbacks? I'm really interested. You've said it a few times. What's going on in the brain that would cause it to relive these events? I know that there's a tangential story related to evolutionary development in the sense of to reduce it down, our brains need to replay traumatic events because if we survive them and don't replay them, we will repeat them, right? We have to revisit these whether it's visual, auditory, if we have survived by definition, we need to pay attention to these moments again and avoid them. But specifically the flashback piece, could you talk a little bit about that and what you've learned by talking to people who experience flashbacks? Because I don't know what it's like to experience a level of stress that intense.
A flashback is not thinking about the event. That would be ruminating.
Okay.
A flashback is a sensory experience where you're maybe something reminds you of it, a smell, a sound, a time of the day, an anniversary of the event, and suddenly, wow, you're back in the event again. Or some cue is going to remind you, some blue pickup truck goes by, and that reminds you of the car that hit, the blue pickup truck that hit you. So you immediately flash onto that event. Now, there have been researchers who've looked at the content of flashbacks, and it's often not the event itself that they flash on, it's the moment before, the moment that they realized that something was out of control, something was about to happen, and they couldn't stop it. Like, the train's coming. So that flashback is often that image. And that often when people have nightmares at night, it's not like, your random nightmare, like we all have that are jumbled and you can barely talk about it the next day because it doesn't make enough sense to make a coherent story out of it. That person was here and then I was there and then this happened. A PTSD nightmare is much more like the story of the event. And so you wake yourself up at the moment when it's just about to happen. And that's why you had a nightmare, because you wake yourself up right at that moment, right before it happens. So flashbacks are kind of like that during the day, but you put a stop to them very quickly. You do something to distract yourself. Some people will do self-harm behaviors to try to stop flashbacks.
Interesting. I'm curious about a very specific scenario. And I don't think it now that I've spoken with you a little bit, I don't think it's classified as PTSD, but it might be related to trauma, which is so take a hypothetical of let's say parents that lost a child at a young age, and they engage in behavior that is for example, they don't touch the room and they view the room that the child was in as sacred, right? Some of these behaviors could go on over the course of decades. I mean, I equate it, it's kind of similar to hoarding, where people are obsessively holding on to objects, sometimes that are just plain old junk because of some connection that they've built up in their head. What's interesting to me about some of these types of examples are that sometimes the individuals don't appear to be distressed. Like they just go about their day. Hey, don't go in that room. That's Billy's room. You can't touch that. But like from the outside looking in, it feels as though people are continuing to feel residual emotions from the trauma. They're not moving past it. For these types of scenarios, like are these still like problems that need to be addressed, or does this fit as something a little bit more gray, where it's like it's affecting them?
What you're describing is prolonged grief disorder. That's a whole other diagnosis.
Interesting. Okay.
Yeah, and it has just gotten added recently. There's still some debate about it because we don't know how long normal grief is, and then when it becomes abnormal.
Yeah.
But they aren't just going about their day. If you tried to open the door and go into little Jimmy's room, they would be freaking out. Don't touch his stuff. And when they're alone, they're having this prolonged sense of yearning for the person. I can't get past it. I can't go on with my life without this person. So, I mean, that's not PTSD, that's prolonged grief disorder. But you're describing it very well.
So, okay, if that's different, then let's take an example of someone who just experienced a traumatic event, what are some indicators that they may need to seek professional help? Because, it is helpful to have this mindset of resilience and being able to move past, whether it's talking about it or social, having a social network. But how would someone determine if they need to seek help after a traumatic event?
Well, if you can think about the traumatic event without like freaking out, then you probably move past it. For most of us who've had major events in our lives, eventually you get to a point where it becomes part of your life story. And when you talk about it or think about it, you think, oh, I remember how badly I felt when it happened, but you don't keep feeling it. But if you have PTSD, there's this sense of nowness about it, that it's still happening. And when you have a flashback, it's like it's happening all over again, or a nightmare, or an intrusive memory. And so then your thoughts about it are still fresh and new, as if you could still prevent it from happening if you just acted quickly enough.
Right. So, in terms of immediately following a traumatic event, what does a person need to do? What would be on their checklist to to help them avoid that long term, that prolonged potential towards PTSD?
Um, Seeking out good social support, knowing that you've got people in your life that you can talk to about this event. And that's why things like sexual assault are so difficult, because they don't talk to other people about it. They're afraid to, that they're going to be judged or disbelieved or something like that. And same thing with sometimes with certain combat situations where they feel shame, or they feel like they should have saved somebody, or that they should have prevented the event, or that they violated their own moral code by doing something. Maybe not intentionally, but let's say people are shooting at them and their unit is shooting back, and then he finds out afterwards that it was a young adolescent that was shot, and now he's like, oh, I'm a murderer, I've
Mhm.
killed a child, even though that wasn't his intention. So sometimes there's things that they don't want to talk about because they feel like if they talk about them, they're going to get judged. So if you want to prevent PTSD, you need to talk about that. If not, a loved one, a family friend, somebody. I mean, and people can go to therapy immediately. There's nothing to stop them from doing that. Um, with somebody who's a trauma expert who can help them keep from getting their beliefs out of whack. I mean, I would love people to come into therapy sooner. That was my one wish. Usually it's 8 or 10 years later when they come to therapy. Um, when somebody finally drags them in and says, like, I'm going to leave you if you don't get help. Um, but having good social support, being able to talk about it, feel your emotions and not be ashamed of feeling whatever you're feeling, whether it's sadness. I mean, and this is one that men have trouble with. Anger is okay, but sad isn't. Um, Allowing yourself to feel those emotions.
Yeah, you're echoing a theme that I've just been uh, hyper focused on lately because it comes up in so many areas in psychology, even perhaps my last episode, but this approach versus avoid. We have this tendency to avoid things that generate negative emotions, and counterintuitively, I guess there is something about moving towards events that seems to be the solution, whether it's traumatic events or life challenges and goals and all kinds of stuff like that. Is that theme quite prominent in discussions of treating trauma?
Oh, absolutely. Yeah, that's the key to getting trauma is to stop the avoidance and move forward. Like, let's look at the event. You're saying it's all your fault. How is it all your fault? You know, what did you do? How could you have stopped it? What did you know at the time? What were your intentions at the time? I mean, so a therapist is going to be trying to help them think it through that what they're saying to themselves doesn't make sense and doesn't hold water. But they've got to figure that out for themselves. So it's important for the therapist just to be asking questions that are going to help lead them to those conclusions.
Yeah, so let's talk a little bit uh, about the professional level treatment of post traumatic stress disorder. You are probably one of the better people to talk to. You've developed sort of your own version of addressing PTSD. What could you just talk about some of the specific principles that I mean, we've talked about a lot of them in general, but could you just talk a little bit about that professional piece and the principles that go into treating PTSD once someone reaches out for help?
Yeah, I mean, the therapy that I developed is called cognitive processing therapy. The good news is PTSD often can be treated very quickly. Um,
Wow.
9, 10, 12 sessions. I mean, it's not something that takes a long time if somebody's motivated and is ready to approach instead of avoid. Um, so what we do is have them think about, what have you been saying to yourself about the cause of the event? It's all my fault. I should have done this. I should have done that. Now, how has it also affected your life? And this is where we're trying to help them with their motivation. Well, I don't trust anybody. I never feel safe. I have low self-esteem. I have, so we actually prompt them on certain themes that are pretty common across different kinds of traumas. And then we kind of start looking at those, what we call stuck points. Those are the things that are keeping them stuck in their PTSD. So it's like it keeps circling around and they never get anywhere, like a dog chasing its tail. And they keep going back to that same point. Um, and thinking it's my fault, it's my fault, it's my fault, and trying to think that, assuming if they can just figure out what they did wrong, that they can prevent bad things from happening again. Of course, they don't realize that if something bad happens again in their life, it's likely to be totally different. And because they're older, they would respond differently. But they get fixated on trying to, like prevent the same thing from happening again or prevent it after the fact. And so they feel guilty that they didn't prevent the event. But so we sort that stuff out and come up actually with a list of stuck points, and then we start helping them understand, like, this event, you have this thought leads to this feeling. So if you say, I was raped, and then you say, it's all my fault, what do you feel? I feel shame. Okay. So now let's go back to the therapist. We go back and start asking questions like, okay, how is it all your fault? Like, what role did the rapist play in this? How can it be all your fault? Um, and going through the event, like, where were you? What was your intention? You were out with friends, and then this happened and that happened and so on. And like, okay, so what did you know at the time, at that moment? If you thought about it 3 weeks later, that doesn't count. Take that off the table. It's only what options you had at the time and why you chose those options that you chose at the time and what your intentions were at the time. And that helps that free them up from thinking that they should have done something different that they thought of, years later. But we actually then start actually teaching them how to be their own therapists with series of questions for each of their stuck points, and then thinking about patterns of thinking, how people tend to jump to conclusions or mind read other people, those kinds of things. I feel fear, so I must be in danger, or I feel guilt, so I must have done something wrong.
So is there a difference as you describe this process? Part of me feels like, oh, well, you can't use reason to fight irrational thoughts.
Oh,
But
yeah,
it
we can.
so 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 you're saying that you can is there I'm guessing that there's something fundamentally different between a therapeutic
Mhm.
setting and peers maybe going over these events. Is that what I'm picking up on?
Peers can have a lot of influence, especially early on. They can say, of course it's not your fault. You couldn't have stopped it. And if they have some credibility, then it's going to take hold. That's why sometimes group therapy can be very helpful, because they can pick out the situation and know those circumstances and know that it wouldn't have been possible to prevent the event. Um, but what a therapist is going to do is going to be, as I said, asking questions, not hammering them, saying it's not your fault, it's not your fault. You put it behind you, forget about it. I mean, when people have natural emotions and cry, the people in your life are going to try to get you to stop crying. That's not therapeutic. that's let's all be comfortable. If we don't think about it, don't talk about it. And if you're not upset, then I don't think you're upset. So that's why people start to hide their emotions, because they don't want to upset everybody else in their life. The therapist is going to be saying, if you feel your feelings, I'm going to just sit here and they're not going to say that, but they're going to just sit there and let the person feel their feelings. But if their feelings are based on those irrational thoughts, then the therapist is going to say, hold it, where did that thought come from? And they're going to ask those questions of, like, okay, you've been thinking this since you were 6. So your 6-year-old self said this is your fault because you're being punished because you must have done something wrong, even though you can't figure out what it was. Okay. Was there ever a time when you clearly didn't do anything wrong and you got punished? Yeah, my mom walked in the door and just hit me one day. Okay, so it wasn't always that you did something wrong. Sometimes it just happened. Okay, so how is that your fault? So you would go through those with a series of questions, trying to narrow or find the exceptions. Like somebody says it happened because I was drinking. Well, did bad things always happen when you drank? Is it possible that a bad thing could happen and you weren't drinking? Maybe drinking is not the relevant factor here. Maybe it's the fact that there was another person who could take advantage of that. Most people who are crime victims leave out the perpetrator as part of their story. They're so busy focused on what they did wrong, they never think to themselves, that person intended me harm.
So that's very interesting to hear. I like this idea, like this, I guess, breaking down and rebuilding of these structures, these thought structures. It's very interesting. And I don't know if this question is redundant or not, but I I always, I always hear the term process. We need to process traumatic events. And on the surface, it seems like it's basically taking something that doesn't make sense and then allowing your brain to make sense of it.
Well,
Um,
it's making sense of it, but it's also trying to get back to a balanced set of thinking. So you don't want to say, because this happened, I'll never trust anybody again. We want to say, I couldn't trust that person, so I got to figure out which ways I can trust people or not trust people. That's a more balanced way of thinking, rather than saying, I'll never trust anybody again. So we're trying to get back to balanced thinking. That's that's frankly evidence-based. Look around and what's the evidence? What are the facts here? Would your thought hold up in court?
Thank you so much for being on today. I feel like it really did clear up the difference between trauma and PTSD. Thank you again for being on, Patricia Resick.
Thank you.
For more on Patricia, visit cptforptsd.com. That's cptforptsd.com. Or pick up a copy of Getting Unstuck from PTSD, Using Cognitive Processing Therapy to Guide Your Recovery, wherever books are sold. If you enjoy this podcast, please share an episode with 2 of your friends. Head over to patreon.com/whydowethatpodcast to become a paid supporter of the show. You'll gain early access to episodes as well as bonus video content. Follow on Instagram or Facebook at Why Do We Do That Podcast, or on X at WDWDTPod. Until next time, this is Dr. Ryan Moyer, hoping you found some answers to the question, why do we do that?